Hello everyone, this is Vicky from NIPER. In this video, we will discuss about the BCS classification. Before that, a small correction from my previous video, that is, a stripping is the separation of your capsule into cap and body, and that separation can be done using bronze jaws, and trimming you are removing unwanted particles. This is a small correction. Now moving on to the BCS classification. BCS stands for Biopharmaceutical Classification System, which helps to categorize your drugs based upon their solubility and permeability for the regulatory approval and for better formulation to increase the solubility and permeability. In BCS classification, we have total four classes: the class 1, the class 2, class 3, and class 4, where the critical parameters are here the solubility and permeability. The examples are very important in point of NIPER and GPAT also. So the class 1 of BCS classification have high solubility and high permeability, where the absorption is very well absorbed because the solubility also high and permeability also high. Here the rate limiting step is your gastric emptying time. And examples are diltiazem, metoprolol, verapamil, and propranolol, where diltiazem and verapamil are your calcium channel blockers, and metoprolol and propranolol is your beta blockers. And the class 2 is the low solubility and high permeability, where the absorption is variable. Here the rate limiting step is your dissolution, because when the solubility is low we have to improve the dissolution, so dissolution can be improved. And the examples are your NSAIDs, mainly naproxen and ketoprofen, the phenytoin, the nifedipine, again a calcium channel blocker, and the carbamazepine and the ketoconazole. These are the examples of your class 2 basis classification. And the class 3 of your basis classification have high solubility but low permeability, where the absorption is variable. Here the rate limiting step is your permeability, because here we have to improve the permeability. The examples are metformin, which is a biconin derivative, very important antibiotic, anti-diabetic, and the cimetidine, acyclovir, ranitidine, atenolol, and captopril. Examples are very important. And the class 4 of your basis classification is which have very low solubility and low permeability. Here the absorption is very poorly absorbed. Here the rate limiting step is your case dependent. Based upon the case, we have to improve the solubility or we have to improve the permeability. Here the examples are your Taxol, diuretics, mainly most of the diuretics will categorized under this class 4 of BCS classification, and the ritonavir and ellagic acid. These are the examples of your class 4 BCS classification. Very important for in point of GPAT and NIPER also, the BCS classification and their examples, the class 1, class 2, class 3, and class 4, the solubility, permeability, high, low, high, low, high, low, low. The examples are very important. So subscribe to this channel. Thank you.